Hello and welcome to our very first episode of the Women's Health Network Healthcast, a podcast series where our advocacy directors lead engaging conversations about women's health, healthcare equity, empowerment, and more. Our aim with this podcast is to provide a platform for stigma-free discussions and raise awareness on topics relevant to women's holistic health. I'm your host for this episode. My name is Victoria Labuda, and I'm currently the Vice President of Advocacy at the Women's Health Network. Our topic for this episode is iHEAL, a free, private, and secure app developed to improve the safety, health, and well-being of women living in diverse life contexts who have experienced intimate partner violence. The iHEAL app is part of a larger nurse-led health promotion program led by Dr. Marilyn Ford Gilbo and in partnership with a collaborative of researchers from the University of New Brunswick and the University of British Columbia. We are honored to give a warm welcome to our guest speaker for this episode, Dr. Marilyn Ford Gilbo. Dr. Marilyn Ford Gilbo is a distinguished university professor and the Women's Health Research Chair in Rural Health at the University of Western Ontario, Arthur Labatt Family School of Nursing. With a background in public health nursing, her research focuses on strengthening healthcare approaches and interventions for individuals living with violence and inequity across diverse contexts. On behalf of the entire Women's Health Network team, we thank you so much for taking the time to speak with us today.
Thank you so much for inviting me to be part of your first podcast. I really appreciate it.
Of course, we're thrilled that you could be here. My first question for you, Dr. Ford Gilbo, is for our listeners at home who may have never heard of the iHEAL app before, could you explain a little bit about how the app works? What kinds of activities and resources does the app have to offer?
Great. Of course. So the iHEAL app is a fairly new hybrid app that was just launched in November of 2023. It's designed for women who have experienced violence from an intimate partner and really as a resource to help them think through their situation, get information and resources that can help them make decisions about their relationship, about any strategies or actions they might want to take, and also options for resources that they may want to reach out to if that's something that's of interest to them. So it really is very much a woman-led initiative in that we come from a place of understanding that, women's experiences of violence and their experiences of health are all very different, and that the control needs to be in women's hands. It can't be someone else who makes those decisions, that women have the understanding of their lives and can do that with information. So knowledge in this case is power. So the app is completely anonymous. It's free, available in English and French, and it can be accessed with a web browser on a traditional computer, if that's what a woman has access to, or on an iOS or Android device, so downloadable, from one of the app stores. So lots of options in terms of how women can get to it. In terms of what's in there, when women go in, what they find is it's organized around 6 different issues that we know are really important to women who have experienced violence. So safety is there, of course, but so much more than safety. So also thinking about pillars on things like family relationships, health and well-being, which doesn't get nearly as much attention as it ought to, reclaiming power, basic needs, those sorts of things. And women can go into any one of those areas and explore what's there. And what they'll find is that there are activities that they can walk through that ask questions for them to think about their situation. And some of those are interactive activities where they will get personalized feedback and suggestions about resources or tips or information about things they might want to consider, actions that they can take in their life to deal with some of those issues. And then, of course, the other thing that is connected is a whole series of links to resources. And the resources are either national or provincial. So it is tailored to the area where the woman lives. And those resources are everything from connections or information about service agencies in a whole range of areas, everything from violence services, of course, to things like counseling, police, victim services, healthcare, sexual assault services, new services for newcomers and Indigenous women, the whole range of issues that we know are connected to violence. So it's very much up to the woman to decide where she wants to go and what she engages with. And along the way, anything that is of interest can be saved very easily by just clicking a little heart. It puts it into a separate curated area so that the woman can go back to the things that she finds most helpful and doesn't have to go through the whole app over and over again. And that includes any of the personalized information that's provided to her if she engages in some of the activities. That can also be saved. So those are her, if we might call them results, things that are the personalized information for her.
That's amazing. Thank you so much for sharing that background on iHEAL. It's very evident to me that a lot of thought went into the design of the app in order to ensure that it sort of takes a really comprehensive approach in supporting women who have been experiencing this type of violence. And so my next question for you is, I'm very intrigued about sort of the origin story of the iHEAL app. Could you share a little bit more about what motivated your team to develop this app?
Sure, yeah. I've been working with this fabulous team of researchers in BC and New Brunswick for, more than 20 years, longer than that for a few of them. We've been doing work in this area of violence against women for a long time, and a lot of our work started off with looking at the long-term health consequences of violence for women at a time when this really wasn't being done very much. And so some of our work there is some of the original work that was done. And yet through all of these many years of experience, we were still finding that, of course, rates of violence haven't really decreased. In fact, they increased during the pandemic and never really decreased again. And we are still hearing how many barriers women face to getting support. So we know that women are actively seeking to, address the violence and try to reduce it and be safer. And yet they face so many barriers, everything from stigma and feelings of shame to services just not being available in their area, to lack of support from family members and friends sometimes, mistrust of services, often for really good reasons. And sometimes it's just really not knowing how to name what they're experiencing or just not knowing where to start. And we have been doing some work around interventions, and some of the early intervention work started shifting to looking at how online or digital interventions could be helpful, particularly, say, in the mental health space. We're finding all kinds of research that was showing effective interventions. And the question then became, well, would it be possible to develop something that would be safe and appropriate and inclusive for women experiencing violence, but that could actually provide a low barrier point of information and initial support for women to decide what their next steps might be. So this is really how we got into the work, and encouraged by colleagues that we have in the US and Australia and New Zealand who all took on some work together initially.
Thank you for sharing that. I think a point to be emphasized that you brought up was that the iHEAL app is a low barrier point of information and support, especially given that today there still are so many barriers that women face when it comes to accessing, resources and these types of interventions. Your team and your collaborators have been researching the topic of violence against women for quite some time. And my next question for you is sort of, how do you take your research on barriers that women face and, violence against women and sort of translate it really efficiently into a digital intervention like the iHEAL app?
I would love to say there's a shortcut to doing this, but the truth is there's not. And the iHEAL app is actually the third app in a series that we have worked on. The very first
Oh, wow.
intervention that we developed was actually started in 2012, a long time ago, in the technology world anyway. And it wasn't a mobile app, as you know it. It was an online app that could be accessed from a computer. We had funding from the Canadian Institutes of Health Research to develop that, adapting a safety decision aid that was developed by our colleagues in the US, alongside teams in Australia and New Zealand. We all worked together and looked at how to adapt, change, and expand or shift what had been developed in the US and to test it here in a randomized controlled trial. But that whole process of development, in fact, before we even got to the trial, took a couple of years. And it's because it's not just a matter of adapting content from one country to another. It's also looking really carefully at the evidence base that exists, because all of the content in the app is based on evidence and best practices, and thinking about how that lines up. So we, in fact, ended up expanding or extending the focus of the app to really take a stronger focus on health and well-being alongside safety and other issues. We also, of course, had to do usability testing with women who would be the users of the app. So we had wonderful partnerships with people in violence services who helped us connect with women who were staying in shelter or who had recently left, and who sat with us to look at the prototypes and to walk through them and to talk out loud interviews with us to explain what they were seeing and what they were feeling and what they liked and didn't like. We did the same process with experts in a whole range of fields, everything from legal experts to people working in violence services, in healthcare, in social services, and brought all of that feedback into the design and the content of that version of the app. And it was the foundation for the current version of the app, which was improved greatly based on the research that we've done, including qualitative interviews always with women, because they will tell us things that we won't be able to appreciate when we're looking only at outcomes in a trial. So yeah, the trial research was very positive. It showed that in testing the first app that we did in comparison to sort of a more static version, that there were lots of benefits around improvement in women's mental health, their control, their sense of confidence, their confidence in being able to plan for their safety, which is really important. And that we learned all kinds of things about how the women were actually using the app in the qualitative interviews, and important things around things that needed to be shifted or changed, like creating greater control for the woman, making it less linear and more interactive and accessible. So again, lots of learnings from that, and then all of that work was pulled forward as we then looked at how technology has evolved and what we could actually do to really rethink the app as we moved it into the iHEAL platform, and didn't have the same constraints around the structure of the app that we had when we were adapting and using the version that came from our partners in the US. So it's informed, and it's quite novel in its approach, because it incorporates so many different areas that are all closely connected to women's safety, but does it in a really broad way.
It's amazing to hear that the app is constantly evolving and being refined as you have these discussions, with women that are using the app. And you also mentioned that the app is not just focused on, women's safety. It's focused on all things that are potentially connected to women's safety. And I think that's sort of best represented in the 6 pillars that the app offers women to explore. We sort of discussed them a little earlier, but they are safety, basic needs, health and well-being, connecting safely, claiming your power, and family. And so I was wondering if you could sort of explain the significance of each of those pillars and, what motivated your team to focus on these 6 areas in particular?
Yeah, for sure. They originally come from qualitative work that we did, 25 years ago with women who'd experienced violence. And in that study, these were interviews with women who had separated from abusive partners and were trying to move on with their lives. And these were the areas they told us were most important. And we know from research that each one of these issues is tightly connected, as I say, to women's experiences of violence. So safety first, of course, has to be part of an app like this. Safety is such an important issue, and we're thinking about safety as more than physical safety. We're thinking about the woman's psychological safety, her emotional safety, her spiritual safety. All of those things are part of women's experiences of safety. But the safety piece is important because it is an area where women can go in and learn more about various ways that violence can affect their health and their lives. They can do, for example, a risk assessment called the danger assessment that provides standardized information back to them about what their risk of serious or lethal violence is. Such an important issue because it's very difficult when you're in an abusive relationship to sometimes appreciate how much risk you might actually be facing. And women talk about this activity as being really powerful, something that really changes their appreciation sometimes of their situation. And then, of course, there are all types of topics, each one of these pillars that follow these activities. And women can explore whatever's interesting to them. So in the safety area, it's everything from, violence services. What can you expect and how would you contact them? If you contact them, what's going to happen? There's information in there about safety planning. So there's an activity they can complete that helps them basically generate a beginning safety plan that's according to their needs and priorities, not someone else's, very personalized. And then information topics to help them understand each of those areas a bit more if that's what they're interested in. For some women, safety is no longer the big issue when they might come in to use the app, and it might be other things. So health and well-being is there because we know that the effects of violence on women's lives are often long-standing. It comes from the toxic stress and sometimes from injuries, and sometimes from ongoing chronic stress or microaggressions that are part of women's everyday lives. And yet health and well-being doesn't get a whole lot of attention. It is one of those things, though, that makes it really difficult for women to move on with their lives. So there's a lot of information in there about the impacts of violence and trauma on women's health and some ideas about how to manage really common problems, things like chronic pain that women don't always connect to their experiences of violence, and also accessing services. Connecting safely is really about family members, friends, having the people around you in your network who can support you on your journey, whatever that is, and helping women just work through, what it is they do need in their life and where they might be able to get that. So even doing sort of reflection on who's in your life right now and how are they helping and not helping what you're trying to do in your own life. It's also about encouraging women to take control of their own story, so that they share what they want to share on their own terms and don't feel compelled to share with others what they're not comfortable with, as an example. And of course, lots of good suggestions about how to connect with services there. Where am I? Claiming your power, I think, is one of the most important ones. It's a lot of it is about women's own personal needs. We don't have a lot of conversations about what women actually want for themselves. We tend to put others in front of ourselves, and yet this is such an important part of healing from abuse. And so the claiming your power is about self-care. It's about thinking about your future goals, thinking about what you want in life and how you're going to get there. It also has some great videos in there that are grounding exercises and all kinds of other things. So those are kind of the areas. I think I've gotten them all. I might have missed basics. I probably missed basic needs, but we know that one of the big impacts of violence is that at least long term or over time, it erodes women's financial resources.
Mhm.
And economic abuse is often part of the pattern of violence. So, being able to unpack that whole issue of what basic needs are and some really practical information about how to connect if women need support with those areas, how to connect with services or other organizations, and strategies they can use themselves as well.
That's amazing. Thank you so much for elaborating on all those areas with such detail. I think it's great how, personalized the app can be and how it's really up to the woman herself to decide what sort of areas she would like to or needs to explore. And I think another great thing about the app is that it's really been designed for all the different kinds of women that might potentially be using the app, whether they're racialized, whether they identify as Indigenous or as part of the LGBTQ plus community. So could you share a little bit more about how the app has sort of taken into account different needs and priorities of women who may be coming from diverse backgrounds?
For us, this has been one of the most important foundations of the work. It starts with the research that it's based on, number one. It added to that are the consultations and interviews that we've done with people from many different experiences and backgrounds to see whether they could see themselves in the work. And really intentionally on part of our team, going through literally every word, every phrase, and every image to try to unpack whether there are unconscious biases, whether these things could be read in ways that would be dismissive of women's experiences or buy into stereotypes. So again, one of the reasons that the app took so much time to develop. We also have tried through the information that's in the app, where it makes sense, to put specific information in that would be helpful to certain groups of women. So, for example, there are places in the app where there are specific messages for Indigenous women. We don't ask women to identify if they're Indigenous, but we might say in a section, if you identify as an Indigenous woman, ... And then there's an explanation about something that might be quite particular. The same issue with women living in rural communities. There are some very particular things around that related to safety planning, for example, or newcomer women, the same thing. And resources also that are specifically for these groups of women. So for Indigenous women, Indigenous specific services you'll find. Also for newcomers through settlement services and other places, and with some unpacking of what kind of help you can get there. So it is trying to be broad. It doesn't go far enough for us, but we feel like we're on the road and that we're asking for feedback. We're continuing to consult and to figure out how we can go beyond English and French. Although I will say that the Francophone version of the app also, it's like developing two apps at the same time. And it's a wonderful resource to have because there are so few resources also for women in Francophone communities across Canada. And we absolutely are delighted with that. We have been able to do both the English and French versions to start with anyway.
That's amazing. That actually leads me very nicely into my next question. How, you mentioned how you're still trying to figure out how to go beyond English and French. And I was interested in, what are the long-term goals of the iHEAL app? Do you and your team have any more plans to, further refine the app or maybe even expand the iHEAL platform outside of Canada?
Yeah, we're always refining. So, part of our priority right now is to get the word out there that this exists, that it's a credible resource, that it's safe, that it's private, that it's confidential, that women don't need to, um, women don't answer any questions that have personal identifiers. We don't collect that information. It's really quite novel in that way. But we're trying to promote the app, but also then, of course, we're hearing or getting requests around additional things that might be done. And, one of the things we're thinking about is whether we might actually add an audio feature. Some of the app is quite text heavy, and for women whose first language isn't English, or whose literacy level is lower, or truthfully, who just prefer to hear it. One of the effects of trauma, is that concentration can be affected, and we're looking at that as an option. We've also had inquiries from different groups about whether we might be interested in collaborating in a version of the app that's for newcomer women specifically. And some requests about whether or not iHEAL could be adapted to other countries. And, I think we're open to all of these types of possibilities, but we'll always want to carefully tread on what does it mean to actually adapt something created in one context and place it in another. And it has to be more than just a language translation, right? There has to be a cultural adaptation, an adaptation that fits with the context and all the above. But, we're really happy as a group to consult, to talk with other groups also that are working in this space, because we really do see that there are some great opportunities here to use technology for good, in a space where sometimes for these women, technology has been used to perpetrate violence, right?
Right. It's great to hear that you and your team are motivated to expand the app. I think it's an amazing resource for women. It definitely is challenging to sort of get that information out there so that women are aware that this is a resource that they have access to and can very much benefit from. And so I hope our podcast is sort of able to play a small role in getting that information out. This is bringing us to the end of our discussion today. But before we sign off, I just wanted to give you the opportunity to, make any closing statements or maybe share something about the iHEAL app that we haven't touched upon yet that you think our listeners would benefit from knowing.
Just to say maybe two things. One is that, we can't do the work of spreading information about this app on our own. And we had a wonderful session with health sciences students about a month ago, who were doing some volunteer activity for one of their, wasn't for a course, it was another initiative in health sciences. And one of their tasks was to help us figure out how we might embed something like this app into service settings. They came up with all kinds of ideas. And I want to say that, we happen to be so privileged to be sitting in university settings with amazing current and future leaders. And we would love to be able to engage students at the universities to help think through some of the ways of shifting this out into the wider world, so to speak. And this was an idea generated by that group. They were talking about a iHEAL ambassadors group that of students that might be interested in partnering with us on a volunteer basis, a little bit of time, and how that might actually really be a wonderful thing. So we're going to take a look at that this summer and see if we might have something organized for the fall. And we would be certainly looking for students who might be wanting to join us in that initiative. And I will say the other thing is that I guess we're mindful of always the fact that the work has to be done carefully. It has to be credible. It has to be safe. And the safety features on this app have been really well developed. But it's because we've been working with a tech company called Stitch Media, which is a local company here in London, that really worked with us to understand the particular needs of women experiencing violence and the need for privacy and safety. And there is a growing number of apps out there that are starting to bubble up in this space, and they don't all take that that approach. And some are maybe a bit opportunistic and are, developed more for profit motivation, and less concerned about and understanding really of the complexity of women's issues and the need for safety and privacy. So just kind of always thinking, all of us need to always be thinking about the credibility and of what we access online. It's an important part of our lives as consumers of all of these wonderful apps that exist.
Definitely. And if I can extend to your team a sort of, thank you for all of your efforts and being mindful of the fact that this work has to be done carefully. It has to be credible and it has to be safe. And, I think this is a topic that you've been interested in for many years. And the fact that you and your collaborators have been so motivated to put it into a actionable resource for women, I think is very admirable. And for our listeners, I was wondering if you could sort of share where they can visit to receive more information about the iHEAL app, whether it's for themselves or if somebody they may know that they think would benefit from, looking into the app, where can they get more information?
Yeah, the best place to go actually is our website, which is ihealapp.ca. And that's you can get the web app there, or take a link to go to one of the app stores if you want to access the mobile app. But the website also has some really good information to help women also think about how they can use the app safely before they even go to download it. And I think it's a great place to go to. There are also lots of resources on that website for service agencies or family members and friends to access. So everything from posters to videos to service cards with QR codes on them that can be used in service agencies, to stickers that we're attempting to decorate every washroom in the city of London and everywhere else that have QR codes on them too. So lots of different resources for people who are interested, but also might be interested in helping spread the word.
Amazing. Thank you so much, Dr. Ford Gilbo. We really appreciate you taking the time to come onto our podcast to discuss the iHEAL app and really share a lot of your expertise with us. We are very grateful for your time. And so with that, I will close off our very first episode of the Women's Health Network Healthcast. We invite our listeners to learn more about the iHEAL app at ihealapp.ca, and as well as to look forward to our next episode. Thank you very much.